Hello everyone. Today we continue our talk about diabetes and its healthy nutrition. Last time we talked about the vegetables, and today we're going to talk about starches and some of the common mistakes that I see people do all the time, making their blood sugar go high. So let's begin. Here again we see the plate method, and you can see the vegetables or non-starchy vegetables that occupy half of the plate on the right side. As we said, these are the main part of your meal, and there are two other parts of the plate. One of them is the starchy vegetables and grains. We collectively refer to them as starches, and the final part is the protein. Now, as opposed to the non-starchy vegetables, where we said really portions, you don't really need to limit your portions. You can eat as much as you want of the vegetables. The starchy vegetables and grains, which we collectively know as starches, that is not the case. You have to be very mindful of how much portion you eat, because they transition or switch into glucose in your bloodstream and can raise the blood glucose level. So we want to be careful, and the way we are careful with three main things. Number one, portion control. Number two, choosing darker options. And number three, choosing one option only of the starch. Now I'll unpack that in the next few slides. As I said in the previous slide, there is a difference between non-starchy vegetables and starchy vegetables. Obviously you know about grains, and everybody knows about grains, that they are transformed into glucose. So nobody, for example, who knows anything about nutrition will doubt that white rice or bread or pasta will turn into glucose, or that it would raise your blood sugar. However, a lot of people get confused about this point of starchy vegetables also turning into glucose. So not all vegetables are created the same. A lot of people eat vegetables thinking that all vegetables are good and all vegetables are okay to have when you have diabetes, and so they might have sweet peas, black beans, lentil, corn, a lot of things that actually are not good for diabetes. There is a difference between the two items, and I'm going to give you a comprehensive list of things that constitute starchy vegetables versus non-starchy vegetables. But I want you to have like a rule of thumb that basically anything that is green or leafy green or dark green, it will tend to be a non-starchy vegetable. There are some exceptions to that, like sweet peas. And anything that tends to be yellow or brown in color is going to be a starchy vegetable, such as potatoes, corn, such as lentils, beans, and also green peas, which we said is an exception because it's green, but it is a starchy vegetable. Now, I want you to I said green peas, not green beans. I meant so sweet peas, basically, or green peas are the ones that are starchy vegetables, but green beans are actually non-starchy vegetables and very good for you to use. I hope that you're not confused about this. I wanted to say that I made a specific video about the starchy vegetables versus non-starchy vegetables, and I called the starchy vegetables vinos, which is vegetables in name only, because really they behave as starches. You can look up on my channel that video and watch it for more details. And here is the list of non-starchy vegetables and of starchy vegetables, so you can read about it. You can pause and take a look, or take a screenshot and read more about them and see what that list constitutes of. A few important items in the starchy vegetables. A lot of people eat thinking they are healthy and they actually raise their blood sugar, include corn, lentils, beans. All kinds of beans are basically starchy vegetables, with the only exception being green beans. So you have black beans, pinto beans, kidney beans, lima beans. All of these are actually starches and starchy vegetables. Sweet peas are starchy vegetables. Some kinds of squash are considered to be starchy vegetables. For example, the carnival squash, red curry squash, and so on. Buttercup squash, spaghetti squash. You can see also that potatoes and sweet potatoes are, prominent members of that starchy vegetable group. They definitely raise your blood sugar and increase it, so we need to be careful about those. So starches in general, whether they are grains or starchy vegetables, will transition into glucose in your bloodstream and raise the blood sugar. Remember, we said there are three things that you need to be mindful of in your starch selection with the meal. Number one is the portion size, and we saw how you have to limit your intake of the starch to 1/4 of the plate. You cannot go over if you feel hungry. If you go for seconds, you need to go for seconds from the vegetables, not from the starch. The second rule that we said about the starch is that you go for dark. Try to get some of the darker options rather than the white options. And the reason for this is because the darker options will tend to have a lot more fiber, which slows the absorption of glucose into your bloodstream. And that helps regulate your blood sugar rather than spike your blood sugar shortly after you eat. So an example of this you see here is multigrain bread versus white bread. White bread will tend to raise the blood sugar much faster and to more significant amount than the multigrain bread because of the amount of fiber and some of the healthy oils that are present in multigrain bread that will slow the absorption of glucose and regulate it. Another example we'll see on the next slide. So here is another example, for example, when it pertains to brown rice versus white rice, that brown rice is better from glucose control perspective than white rice because it has more fiber. It which slows the absorption of the glucose into your bloodstream. It gives you less of what we call net carbs. And you may ask, what's net carbs? Net carbs is the total amount of carbohydrates present in the meal minus the fiber that are not absorbed into the bloodstream. So basically, it's the amount of carbohydrates that get absorbed into your bloodstream. And brown rice tends to do much better than white rice. And in general, anything that looks dark is going to be better than something that looks white. Now, I have to caution you about something because I've heard it a lot of times said, and patients or people tend to misunderstand this and apply it wrong. I've heard it explained or told to patients, don't eat anything white. And that tends to make them think that anything that is dark is okay to eat in any quantity. So, for example, they might eat whole wheat bread, but they eat a lot of whole wheat bread because they have this false sense of security that whole wheat bread is okay. It's not going to raise my blood sugar. I can eat as much as I want. And that is not the case. Remember, with the starches, we have to obey 3 rules. Rule number 1 is the quantity. And I would say that rule number 1 is the most important rule. Actually, is that you have to limit the quantity of what starch you eat in the meal. If you choose to obey rule number 2 and have like a darker form of starch, so quinoa or buckwheat or brown rice or whole wheat pasta, instead of their white counterparts, that's better. However, don't undo the good benefit that you had from switching to a darker option by eating a lot of the darker option, because they will affect your blood sugar if you eat too much of it. Even if it is darker option, even if it has a lot of fiber, it's still rice, it is still pasta, it is still bread, it still has a lot of carbohydrates, it is a starch, and it's going to raise your blood sugar if you eat too much of it. So I go again and say rule number one is limiting the quantity of the starch, and that is more important than rule number two and rule number three, which we will talk about in the next slide. So here is another example of rule number two, where darker options are better than white options when it comes to something like breakfast and you're choosing between oatmeal and cereal. Well, which one is better from the blood sugar perspective? Oatmeal is better. Oatmeal, as you can see, is brown or dark versus cereal, which is white. Now, of course, there are multiple things that go into it, and I don't want to be very specific. There are various kinds of cereal. Oatmeal can be cooked in multiple ways that can make it unhealthy. You can add brown sugar to it, which makes it high in sugar content. You can do like they put here, they ruined it a little bit, in my opinion, by adding the bananas, because bananas have carbohydrates, a lot of carbohydrates in them. And so, it's not as simple as that, but if you get to the basics, just pure oatmeal versus pure cereal, which one would you choose? You should choose the oatmeal because it has darker texture, and what that means is that it has more fiber. It's going to be less of a hit to your bloodstream from the glucose perspective, and so oatmeal would be better. So now let's go back and see if we remember the rules when it comes to the grain foods and starchy vegetable food, which we refer to as the starches. Rule number one is the quantity. You have to limit yourself to 1/4 of the plate, basically. So maybe about half a cup or a little bit more than half a cup, but not much more than this. Now, what is a cup? Because a lot of people don't know how to measure or how to estimate just by looking at it. So an easy way to estimate it is by having a tennis ball or a baseball in your kitchen or in the dining room. And I encourage my patients with diabetes to have a tennis ball in their dining room, not just because it reminds them of exercise, obviously, but the most important part is because it is a representation of 1 cup. So 1 tennis ball equals about 1 cup. So if you visually can look at the food and each portion of the food that you're going to eat and try to crumble it up into a ball, how much would it be compared to that tennis ball? If you're going above the size of a tennis ball, then you're in trouble when it comes to starches. So quantity is very important. Number 2, we said go for dark, which we see they implemented that here. And number 3 is to not take more than 1 choice of a starch. So that mistake is also very common and frequent. Somebody may limit themselves in the portion of the starch, but they may have 3 starches in one meal. So they may have, for example, bread and rice and corn. Well, that's 3 starches. Even if you limited yourself to a smaller option or a smaller portion of each one of the 3, just by fact of adding 3 starches, the amount of carbohydrates in them adds up, and you end up having a high carbohydrate meal that affects your blood sugar. So the best way to do it is to limit yourself to 1 choice. Now, somebody may ask, and I know that there are some websites that advocate that, and they will say, okay, well, if I eat a small amount but multiple choices, isn't that still okay? Well, in theory, yes. In practice, it just doesn't happen. I mean, what homekeeper would prepare a meal of rice, for example, cooked rice, so that people at home would eat like a spoon each of rice, and prepares, for example, a second starchy vegetable like corn, and they would have like each of them have a spoon of corn, and then a piece of bread. Practically this just doesn't happen, because if you really want to limit your portion and you want to have multiple choices, you would have to just cut back the portion to ridiculously small amounts. At least here, when we have one choice of a starch, you can have 1/4 of a 9-inch plate. But if it comes to multiple options, how to fit 3 options of starch or 4 options of starch in a quarter of the plate, you would need a microscope to be able to kind of visualize each one of those options and put it on the plate. It just doesn't make any sense. It's not practical. It's not how people eat in real life, even though some places advocate for that. Just use your knowledge of your daily habits and the kitchen to kind of think of it, and it will make sense to you. Now, I want to switch to talking about the third part of the plate that we see here, which is lean protein. And we'll talk more about protein. Proteins are very helpful because they are very filling, and they are also necessary for good health and to remain in good health and have strength. So we'll talk more about that in the next slide. Let me know your thoughts in the comment section. Is there something you learned about your pattern perhaps of eating starches that might be getting you into trouble? If so, what can be done to improve the blood sugar by changing the way that we eat starch? Let me know your questions as well, and until the next time where we will be talking about the protein.